Hi, good afternoon, Professor Green. This is Elisa Cordero. I am doing this video as my checkoff for the indwelling catheter insertion. Before I start, we would start out by making sure that we have an order for the indwelling catheter and a reason for it. Once I have obtained my order and my reason, I would gather my supplies, which I have right here. I would also grab an assistant, whether it be another nurse or a nursing assistant, to assist me during the procedure if need be. Once I have gathered my supplies, and my assistant, I would walk into the room, wash my hands as I'm walking in, and I will introduce myself to the patient. Hi, Ms. Gonzalez. My name is Elisa. I'm going to be your nurse today. I would also identify the patient, and there's different ways of identifying the patient. I would be able to identify the patient by asking them for their first and last name and date of birth, and I would look at their wristband to see if the information is correct. I would also look at the name and the date of birth on my order, and also if we have the scanning capability, we would be using that also, so the barcode on their wristband. Once I have identified my patient, I will explain to the patient what I am here for and what the assistant is here for. So Ms. Gonzalez, I'm here today to do a procedure called the insertion of an indwelling catheter. Your provider has ordered this, and if it's okay with you, I'm going to go ahead and insert the catheter that he spoke to you about earlier today. Is that okay? Yes? Okay, great. Once you have gotten permission from the patient, you can continue. I would first start by draping the patient, asking my assistant also to help me in that so that we can maintain privacy for the patient. And then I would proceed to peri-care. I would wash my hands, put on some gloves, do the peri-care for the patient. Once the peri-care is done, I would remove my gloves and wash my hands again. Then I would come back and I would tell my patient to prepare them. I'm just going to have you continue to lay flat on the bed, but I do need you to raise your legs up for me in a bending position, and you're going to have your feet flat on the bed. And then I do need you to spread your legs open. I will have some drapes to provide you privacy. I know that this may be a little bit uncomfortable and it may make you feel a bit vulnerable. Once I've had said that to my patient, I would gather my supplies, which I have here. Remove them from the kit. I can use this bag as a trash, so I'm just going to roll it up and put it down below me, or you can put it on the bed next to you in between the patient's legs. Then I would open my kit. This kit is sterile, so there is a particular way of opening it. So I would be opening it. I have a 1-inch border that I can touch, so towards me, away from me, outwards. And I like to use my 1-inch border to kind of just move this around and position it where I need it. Then I would continue by putting my gloves on, and everything within the kit is sterile. And then I would start by putting on my gloves with my dominant hand first. So you can grab the glove from the cuff because the inside is bended up and the inside is not sterile. Then to grab the next glove, you would use the cuff and put your hand underneath, like so, and put it on, making sure that you do not break sterility. Once the glove is on, you can touch the outside because this hand is sterile. Then I would dispose of this, touching only the middle because that is sterile, and throw it in my trash. I would then inform my patient I am going to be putting a drape underneath you just so that we can keep you nice and clean and so that we don't moisten your bed, okay? And we would put this drape underneath our patient with the glossy side down. So you still need to try and keep sterility. Sorry. So just place it just like that, touching just the middle. Then I would inform my patient that I also have a drape that I would put over the area that I will be working on so that it only exposes the area we will be working on. And also with the glossy side down. Then I will be moving this just a tad bit. And opening my swabs. I like to take them out so that I can just set up my area completely. Place them in my tray. Throw that away in the trash. Then I will be opening my lube, squirting it in my tray, throw in my trash. I then like to pull this out. Move this over. I am putting my hand right in the center, pulling it over to put it closer in between my patient's legs, just because it gives you a better area and better angle to work with the patient without breaking sterility and having to turn around. Then I would like to prepare my catheter. And you need to be very careful because the catheter tip is sterile. So I just pull it out, throwing this away, and I just put it into my jelly. I also like to prepare my balloon ahead of time because once I start the procedure, I will only have one hand to work with that is sterile. So get rid of that. Put it into my port all the way. And we no longer test the balloon just because of evidence-based practice has shown that we can actually do more damage and actually defect the balloon while testing it. So now that I have all of this ready, I'm going to clean the patient and prepare the patient. And I will also ask the patient if they have any allergies to iodine or to latex because I am using latex gloves and because we are using betadine. Do you have any allergies, and specifically to shellfish, iodine, or latex? No? Okay, perfect. So next I'm going to be cleansing the area. I'm gonna do it with 3 swabs. You're first gonna feel it on your outer labia, then on your, on your right outer labia, then on your left side, and then straight down the middle from top to bottom, okay? So I grab the first one, open the area so I expose the meatus, and I'll be cleaning right side first, discard, left side, discard, straight down the middle, discard. Then once I have done that, I would grab my catheter, which is already lubricated, and I would inform my patient. I'm going to insert the catheter now. I'm going to have you take a deep breath and try and blow out slowly. That'll help it be less uncomfortable for you, okay? I'm going to count down for you, okay? So at the count of 3, 1, 2, 3, would begin to insert the Foley catheter into my patient. I am not meeting any resistance, so I continue to put my Foley catheter in. Once you have gotten some urine return, you would still put it in about 1 to 2 more inches. Now that it is in, I would fill up my balloon completely. Once your balloon is filled completely, you would tug on the balloon, on the catheter, I'm sorry, to make sure that it doesn't come out. And the reason why we're doing this is to make sure that we are past the sphincter. Now, if I needed to get a urine specimen, a sterile urine specimen at this point in time, I would use the port to get any urine samples. And if for some reason there is no urine in the actual catheter, you can just kink the catheter like so. We have this nifty little clamp here that you just put around it like this, and you would just wait for it to collect urine, and once it collects the urine in the actual catheter, then you would be able to use your port to get the urine sample. Now, once it is in my patient, I would make sure that I tape the actual tubing to the inside of the thigh of my patient, not underneath, not anywhere where the tubing can go underneath their leg, just because when patients move, they can tug on the catheter and actually do some damage to their sphincter and pull out the catheter. And then I would make sure that my bag is clamped, which it was, and I make sure that I would hang my bed below the bladder of the patient and on the side of the bed, but making sure that it is not on any area that is movable on the bed, like the side rails, just because, once again, the movement of you pulling up the side rails, if your bag is on there, can cause it to pull out the catheter and cause more complications and damage to the patient. So that is there on the side. Then once I am all done with the procedure, I would remove my gloves like so. All of this is no longer sterile. I would clean up my area, picking everything up, putting it away, throwing it away, and then I would drape my patient up again, put them into a position that they feel comfortable, give them the call light and make sure it's accessible to them, and exit the room if they don't need anything else from me. Once I exit the room, I would document that the insertion was done by me, at what time, and what was the size of the gauge of the catheter. Thank you.